Family Medicine in 5. Today we're going to talk about pink eye. So pink eye, the medical term is actually conjunctivitis. Remember that conjunctiva is the covering that's over the eye. It actually goes over the whole eye and actually turns up under the eyelids as well. And so conjunctivitis is inflammation of that covering. There are multiple things that can cause that to be red and angry. The 3 that we're going to talk about today is bacterial, viral, and allergic. Remember, there are lots of other causes for red eye, and some of them are acute and need to be seen emergently by the ophthalmologist. And so if you're having something that's not getting better, you need to make sure that you get in with your specialist. So this is where medical history is super important, how we can determine, because red eyes or pink eyes kind of look all the same when they come. So bacterial, that's usually the one that we think of when we think of pink eye. It's the one that my kids all have pink eye, and I've got pink eye as well. It's super contagious. What we see with bacterial conjunctivitis is we see a lot of mucus, a lot of discharge. Patients will wake up just matted, shut, and it's the one that you think of in daycares, honestly. And so there are 2 bacterial medications, 2 antibiotics that we often use. One of them is drops called Polytrim. That's the one I usually use. Or it can be an ointment called erythromycin ointment. The erythromycin ointment is a little bit messy. It goes in like a strip of Vaseline, and so you put it in your eyelid and then you kind of blink it in. It does seem to stay around a little bit longer than the drops, and so I do use that quite a bit as well. The second type of conjunctivitis is viral. So viral patients will often get like this gritty feeling, and they feel like something's in their eye. Very commonly we'll see it associated with a systemic infection, so a patient's got a cold. Remember, anatomically, there is a little tube that goes from the nose up into the eyes. That little dot on what we call the inner canthus is actually a drainage hole. That's actually why your nose runs when you cry, because those are tears coming down. So the same way that comes down, that infection in the nose can raise itself up and cause infection in the eye. If it is a viral infection, there's not a lot that you can do. There's no antiviral drops that we use. We use a lot of warm compresses, so getting a wash rag, getting it a little bit wet, put it in the microwave for a few seconds. It should be cool enough to hold in your hand. If you can't hold it in your hand, don't put it on your eye. I have to remind patients of that for some reason. And then holding that on multiple times per day. Now, both bacterial and viral are super infectious, so you want to wash your hands every time you touch your eye. If you're using a wash rag, get a fresh wash rag every time. The last one is allergic, where I'm actually seeing a ton of allergic in clinic right now. And so the hallmark of that is the itch. So if you're feeling like, man, I can scratch my eyes out, that's usually allergic. And then that's the watery, kind of just that drainage, and it's usually just clear. How you help with that is usually an over-the-counter drop. I really like one called Aloe or Zatador. Both of those used to be prescription, and they're over the counter now. They're good quality drops, and it can sting a little bit if your eye is pretty irritating, but if you use it every day, then actually it'll get better. For all of this, we do like you to use a wetting drop. I don't love anything that says get the red out, because it kind of clamps down on those vessels, and so when I have an infection going on, I want as much perfusion, and that's what the warm wash rag does, is it brings a lot of stuff into the eye to help get rid of that infection. So I try to stay away from Visine or other things that say get the red out. The other thing that you should avoid is you should avoid wearing your contact lenses, because if you've got bacteria in that, you shouldn't be putting it back in. And then the last thing I want to talk about is styes. So the medical term for that is actually a hordeolium. Fancy word, but it's really just a stye. Most styes are not infectious. Most styes are just a clogged gland. And so you'll kind of see that marble, that swelling, either on the lower eyelid or the upper eyelid. How we improve that is we actually just use those warm hot compresses multiple times per day, hold it on, kind of massage it a little bit. If it does have a lot of purulence, like that discharge in the eye, sometimes I'll use some of the erythromycin ointment as well. Remember, if something's not getting better, if it seems to be progressing and the treatment that we're giving is not improving it, then we want to get you into a specialist. We want to get you into ophthalmology, because there are a few weird things that it could be that can damage your vision. If you ever have vision changes, when you've got a lot of gunk in your eye, sometimes it looks a little foggy. But if you have holes in your vision, double vision, anything like that, you should definitely not wait on that. Okay, that's eyes in a nutshell. Thanks so much for watching.